So mind, body, and spirit, and the connection between those and true health kind of come down to 4 foundational pillars. And I talk a lot about this in my practice, how these 4 pillars of true health are really what establish a good foundation for patients in creating health and wellness. So the first pillar is nutrition. So looking at things like a plant-based diet is kind of where I feel like the best nutritional plan for patients is. Looking at things like, cutting out processed foods, refined sugars, and really looking objectively at a patient's nutrition is really a foundational piece in getting our patients to a place of true health and wellness. So pillar number 2 is exercise. So patients really need to think about exercise more in a pleasurable way. So if you like to run or if you like to do Zumba, those are the things that you should pursue. If you hate running, don't go for a run. So find something else that you love to do. Pulling yourself out of the box and finding something that you love will make you be able to incorporate exercise into your life in a more pleasurable way that's more maintainable. Because if you hate to do something, you're less likely to do it. If you love to do something, you're more likely to do it, which is a pretty simple idea, but I think patients kind of sometimes view exercise as always going to be not pleasurable. So I always encourage my patients to find something that they love. If it's it's just thinking outside the box and trying different things, because it's almost guaranteed that you can find something that you love to do as far as exercise. Pillar number 3 is sleep, and sleep is so paramount for perfect health. Sleep is kind of underestimated, I think, as far as the importance of sleep. We're all kind of chronically sleep deprived as a society, but really trying to get those 7 to 8 hours of uninterrupted sleep is really important. And I talk a lot about sleep hygiene, so making sure that you're going to bed around the same time, you're waking up around the same time, that you're not doing anything electronic in bed, because that LED light can be very stimulating to the brain. You're also kind of getting into the sleep mode about an hour before bed, so turn off your electronics about an hour before. You want to maybe take a hot bath, or maybe drink some herbal tea, do some meditation, these things that can kind of train your brain to start preparing for sleep and make it easier for your body to get there once your bedtime is there. Pillar number 4 is stress management, and this is a huge topic that I think is really important and not talked about very much in doctor-patient relationships, because it kind of takes a long time, and I think it's kind of underestimated as far as the importance in stress management and chronic disease management and prevention. So stress management is, you really have to take an active role and be proactive about managing your stress, be it yoga or meditation, doing something every day that helps you offload that stress. Unplugging from your electronics, kind of connecting with nature, meditation, these different modalities. Exercise is a great way. Just being proactive and managing your stress in a way that you make it a priority in your day, and you set that time aside for stress management and relief from stress, because nobody can get away from stress. Everybody's stressed out. We're a stressed out society, but really utilizing some time every day, be it 5 minutes, 30 minutes, an hour is ideal, but using that time to kind of reestablish that balance, that inner balance, and offload some of that stress is really important. Part of stress management is mind management, and that comes to patients who may be struggling with depression or anxiety or mood disorders. And when you look at the research, these problems, these diseases that patients are struggling with can lead to chronic medical problems such as high blood pressure, diabetes, obesity, certain types of cancers. So they really play a big role in chronic disease for patients. So looking at how to, one, recognize them as physicians and as patients, as friends, as colleagues, recognizing those things in a patient is really important, and treating that in a holistic way. So when it comes back to that mind management or stress management, looking at ways that you can help treat a patient in a holistic way that helps them to reach their goals and get to a place of true health and wellness, maybe without the use of medications, using things like meditation and yoga, or connecting with nature, exercise. These are all things that really play a big role in helping patients deal with these kind of mood disorders. Really, no matter where you are in your life, no matter if you're have a disease process already, or you're just trying to prevent, these 4 pillars will keep you healthier no matter what. If you're having to take medication or not, you're always going to do better if you have that solid foundation intact.